When we're then talking about all these kind of measurements, whether it's custom designed or off the shelf, I'm assuming that a big part of this is to do proper validation. We need to know that the assay is performing the way it's supposed to. It needs to be precise, it needs to be accurate in all aspects of the drug discovery process. And of course, depending on the stage, I guess there's different validation criteria that we need.
Exactly. So when we think about the first stages of development of an assay, this could be a fit for purpose, just to understand whether we can measure that analyte in the specific matrix and to get the first, let's say, first feeling of how the assay works. This can be validated to a certain extent for preclinical applications in cellular models, mouse models, but then of course, when this becomes relevant as a clinical support, this has to be transferred to the regulated environment, and in that case, follow a specific validation protocol, which follows usually FDA-based guidelines or European-based guidelines. And this validation, as you mentioned already, follows there are a few parameters, of course, that we have to follow, such as precision and accuracy. We want to make sure that we are measuring always the same amount of the analyte and that different measurements do not disagree with each other, they're not scattered, but actually that we are always be able to accurately measure our analyte of interest, but also that we are robust and that the reagents are stable. So there are several parameters to take in consideration into this validation process, which could be also reviewed by authorities, and that usually would require a validation report that we generate when this validation is completed.